October is Down Syndrome Awareness Month, a time to highlight the stories of those with the condition.
A medical breakthrough is having a positive effect in treating sleep apnea, a common condition for those with Down syndrome. WGEM Shakayla McCamick reports on the impact it's had for a local family in Marion County.
Because of his sleep apnea, which is a common condition for those with Down syndrome, it was nearly impossible for Elliot Doherty to get a good night's rest just 5 years ago. Since being introduced to Inspire, his sleep has improved, so much so that his teachers, peers, and parents have noticed a difference.
That's on or off. Listen, through here.
Elliot Doherty was born with Down syndrome and diagnosed with sleep apnea at 4 years old. For years, he had trouble sleeping, which negatively impacted his concentration in school.
There is a dramatic effect on students' alertness, on their academic achievement and behaviors when sleep is compromised. So sleep is essential, just the same as eating.
And how long he could keep up with his friends while playing.
He was so tired from school, and if there were a bunch of kids over at the house, then he'd be the first. He couldn't keep up, and he would be the first man asleep.
After trying various treatments with little to no results, Kate learned about Inspire, a medical device used to treat sleep apnea inside a person's body. In hopes of avoiding an invasive surgery for Elliot, she signed him up for a clinical trial, and he's the 21st kid in the country to receive the treatment.
This thing that was already approved for adults, that cured sleep apnea, but it was a trial for children with Down syndrome, and it had these really cool side effects as well as just being an outpatient style surgery. You got implanted. The side effects were improved cognition, improved speech and language fluency, improved articulation, improved sentence utterance length, improved behavior, and improved social emotional.
Ear, nose, and throat doctor Abraham Sheffield says the Inspire implantation procedure is less invasive than other operations Elliot could have faced.
And so you're addressing soft palate closure, you're addressing tongue and back of the throat closure with one procedure by stimulating a nerve. The way we do the operation is through 2 incisions, about 5 centimeters right under the chin. We usually do the right side, and about 5 centimeters in the upper chest.
5 years later, Elliot is sleeping better at night. So do you feel better at basketball practice then?
Oh yeah, I know a lot better for it. And playing some basketball so good.
Seeing improvements in school.
Elliot's speech has dramatically improved, which has increased his confidence as well as lowered his frustration level in communicating with his peers as well as teachers and staff here at the school.
And he's able to keep up with his friends, even enough to score a bucket or 2 against them. Shakayla McCamick, WGEM News, Philadelphia.
That was Shakayla McCamick reporting there. Elliot's mom, Kate, says his doctors were concerned that the long-term effects of untreated sleep apnea would mean he'd need an open heart surgery in high school. And since getting the implant, Elliot's doctors say the operation can be postponed anywhere from 15 to 20 years.